Welcome to eZeLiving.com. I'm Jan Herdman, and today we're speaking on the Smile Makeover with Dr. Michael from Dr. Michael's Dental Clinic. Welcome and thanks for joining us.
Thank you for having me here, Jan.
A pleasure. Can you explain to us what is a Smile Makeover? What does it entail?
Well, patients who are not happy with their smile usually come in because they have concerns about the color, the shape, the position of the teeth. Unlike in the past, where cosmetic dentistry was about creating very standardized teeth, today it's about facial aesthetic design.
Okay.
Let me tell you a few words about it.
Please do.
If you think of the lips as the stage, the gums as the curtains, and the teeth as the actors, it's about placing them right on this stage, so when a person smiles, it looks natural, beautiful, and gives that wow factor.
So not everyone is the same, okay? So you don't say this is how each mouth is going to look. You actually design the smile, the teeth for each person. Is that right?
That's true. It's the couture, it's the Da Vinci, it's the artist in the dentist that comes and actually live creates the smile as a mock-up for the patient, for them to see before they do anything. And it will also be able to explain to them what it involves.
So does this have a name?
Well, it's called facial aesthetic design, and it's about creating veneers, which are very, very, very thin laminates that are added onto the teeth, about 0.3 to half a millimeter thick, very subtle, and gives that change in the smile or the angles of the teeth that really goes right in the face.
So can your patients, can they see what it's going to look like before they have it done?
Absolutely. The first consultation is usually the patient comes in and has picture shots taken, models, x-rays, and the dentist seats the patient or the man in the chair. It's not always a woman. So, and he actually live designs the smile, what goes right in that face, to show what's possible, informs, explains the procedure, and the patient really knows before they start anything how they're going to look in the end.
And how long does that procedure take?
This first visit would take about 60 minutes, not longer than that.
Okay.
Yeah, it's pretty magical.
Fantastic. So, important question, is it painful?
Not at all. The patient does get gel and local anesthetics, which means they're numb. They will not feel anything about the procedure. On the day of the seating, which is about a week later after the job is done, they can feel some discomfort or sensitivity during the first day. Depending if the teeth are very, very sensitive to start with, they could, endure some sensitivity for a while, which can be taken care of with the fluoride mouthwash.
Okay. And do the teeth, once the procedure has been done, do the teeth deteriorate at all? Does it damage the teeth?
No, on the contrary. You see, permanent teeth erupt at the age of 12. Yes. A patient comes in that's 45 or 50 years old. They've had these teeth for, let's say, 33 to 38 years. Now the enamel is thinner. When you do veneers, you're adding life. You're promoting the life of the tooth longer. So it does not deteriorate the tooth, it gives a longer life, because the wear and tear then happens on the veneer rather than the natural enamel.
Well, also a really important question is it expensive?
It's not expensive. You have to put it in proportion to everything else in life. I would say a smile makeover with the upper 10 teeth, would be about 45 to 70,000 dirhams. And that's if you really got to get a good job, a good ceramist, and a top-notch dentist who is an artist who can do the job for you.
Okay, so as you say, you do need an artist who can look at the face and decide which way the teeth should look.
Actually, the dentist needs to show you before you start. Exactly. And create it, so it's not a, it's not a thing you do on the laptop and copy and paste. Ta-da! Exactly. This is live. You can wear it, go and have a cup of coffee with your sweetheart or your husband, and say, this is what I want to look like.
Fantastic. And does it last?
Oh yes, oh yes. You can get it for a good 15 years. You do need to take care of them, Oral health of life is about brushing, flossing, seeing the dental hygienist, and taking care of them.
Fantastic. Well, I found that really educational, so thank you very much for joining us.
Thank you, Jan.
And if you have any queries, suggestions, comments, then please leave them below. And again, thanks for joining us. See you next time. This is Jan Herdman on eZeLiving.com.